To begin with, I want to give you a context in which to understand what I'm going to present to you about managed mental health care and how we deal with memory recovery therapy. First and foremost, I'm a psychotherapist and a psychologist, and my orientation to therapy is probably best described as a cognitive existential model. Within that, I believe, along with one of the earliest cognitive therapists, Alfred Adler, who also was one of the first family therapists, that what we remember about our childhood is much more important than that which we cannot remember or have forgotten. I believe this is very congruent with what we know about brain functioning and memory. I've treated individuals in a generalist practice. Within that, I've frequently treated individuals for whom sex abuse has been problematical. And I've done that ever since my first practicum 20 years ago. I frequently use hypnosis as a technique. I frequently use guided imagery as a technique. I do not use either of these techniques as a vehicle for recovering memories. It's a bad way to do therapy. I do use these techniques as a way of helping people put to rest and make peace with those recollections that they do have that are painful and that are interfering in their daily functioning. I'm going to digress for just a minute, and as much as I hate to defend my psychoanalyst brethren, I think that something needs to be noted here. A lot of what actually goes on in memory recovery therapy doesn't have much to do with psychoanalysis. It has much more to do with Fritz Perls' Gestalt therapy. And in fact, I have a treatment protocol from Two Rivers Hospital in Kansas City, which is a Masters and Johnson's treatment program that relies heavily on memory recovery therapy. And their protocol is, in many ways, in certain sections, is almost verbatim out of Fritz Perls' book, Eyewitness to Therapy. I'm not sure that it's any accident that Fritz Perls' companion volume is titled In and Out of the Garbage Pail. For the most part, I didn't pay much attention to any of these issues as I was in solo private practice. I focused mostly on attempting to tidy up my little corner of the world until I came to managed care. Now, I'm curious here, how many of you do not know what managed care is? Got a couple of people. Let me just briefly tell you what managed care does. There are several different ways that it's done, but in general, what managed care does, it operates much like an HMO in which there is somebody who is a gatekeeper to treatment. In our particular situation, if you fall under our domain of care and you want outpatient treatment, what you do is you call us. One of the psychologists on staff will visit with you briefly about what is going on in your life, and if it seems reasonable for you to have counseling or therapy, we make a referral. We do the same thing with inpatient utilization, so that there is a person there that is managing and approving coverage. What we do technically is we approve whether you're going to get insurance coverage. Most of our clients are self-insured trusts. But through some serendipitous circumstances, in 1991, I became the director of a staff model clinic. We provided the mental health and chemical dependency services to a 25,000-member HMO. 2 years later, I assumed my current position as the director of clinical services at Preferred Mental Health Management, wherein we provide mental health management services and utilization management services for self-insured trusts. Currently, we have about 800,000 people who fall within our domain for management. Our largest client is Walmart. We do all of the utilization or inpatient utilization management for Walmart stores nationwide. In my role as utilization manager over the past 4 years, I have overseen the care of somewhere around, or in excess of 2,500 cases, individual cases. I've quit counting at this point. And the services have been provided by hundreds of psychiatrists, psychologists, and clinical social workers. Currently, I manage about 100 inpatient cases a month and about half as many outpatient cases. Many of these are cases wherein sexual abuse is one of the treatment issues. My first experience with memory recovery therapy came in the first week when I went with managed care. I interviewed a young woman who asked for counseling. She had a disease and surgery had been recommended to her for her disease. And she wasn't sure whether she really wanted to have the surgery. And so she indicated to me that it would be helpful to her to see a counselor to help her sort out her options. This made good sense to me. And so I referred her to a colleague whom I had known for quite some time, an individual who was very well respected in the community, one of the individuals who frequently puts on programs for on ethics and such, and he was a nice guy. I didn't know much about his therapy background. I did know that he was part of the provider panel that had been set up before I came to the managed care situation. So I authorized coverage for 6 sessions to help her sort out her issues. And then I got a request for 8 more sessions, and I didn't think much about that as I authorized coverage for 8 more sessions. And then I got a request for 8 more sessions. And at that point I began to scratch my head. It didn't seem very reasonable that it was going to take 14 sessions and now another 8 sessions to make a decision about whether to have the surgery or not. In fact, in my experience, most of the cases that I treat, and I am a believer in brief therapy, I rarely have seen somebody in therapy for more than 4 months. But at any rate, I scratched my head and wrote him a letter and inquired as to why this process was taking so long. And I got a letter back from him stating to me that as he had worked with her, he had been impressed by how the manner in which her disease had invaded and intruded on her body, and that seemed to parallel very nicely the way her father had intruded on her emotionally. And that therefore, he was relatively sure that she was a victim of sexual abuse. And as we've heard in many stories before, sure enough, he discovered she had been sexually abused, not only by her father, but also by her mother. She also ended up being in the hospital for 2 weeks also. As far as I'm aware, she's still in weekly therapy with this therapist, and that's been 4 years ago. It was completely incongruent with my experience as a therapist and incongruent with my experience in treating sexual abuse issues. As I came to discover, this kind of treatment wasn't particularly unusual. Over time, as we saw some more and more people who fell within our domain in memory recovery therapy, and usually the way this worked is they would be in memory recovery therapy and then their insurance would shift and come into our domain, so they were usually already in therapy by the time we saw them. Well, part of what I noticed was a pattern that began to emerge. First of all, it always seemed to be the same therapists who discovered sexual abuse. That was puzzling. And it didn't matter what the presenting problem is. And as some speakers have said before, people usually don't go to therapy wanting to deal with sexual abuse. They go to therapy because they're depressed or having relationship problems or so on. One of the other things I noticed was these patients seemed to always really like their therapist and think their therapists were doing a wonderful job. PTSD was very frequently the diagnosis, even though there were no supporting symptoms other than the individual having been abused. They almost always had read one of the recovery books, usually The Courage to Heal. And they almost always seemed to get worse. They didn't get better. Usually, or in most cases, there were at least 1 or 2 suicidal crises, usually requiring a period of hospitalization. And finally, there was almost always the emergence of bizarre sexual abuse, It wasn't merely being fondled or whatever. It always became something else. And I was kind of interested to hear other people having experience with people who had recovered memories of being sexually abused before they were born. We had one of those also. She also had recovered recollections of having murdered 3 children in satanic rituals before she was 7 years old. And she was supposed to become one of Satan's high priestesses. Have you ever noticed how they're always going to be one of Satan's high priestesses? Nobody's going to be the scullery maid? No. I finally concluded that memory recovery therapy was not only nonsense, that it was dangerous. Further, it's very costly. Slide. Well, somewhere I have a slide. We had it earlier.
I told you they knew what they were doing.
I only have one. I'll tell you what the slide is about. There we go. This is looking at the cost. These are 4 different individual patients. Now, these were patients who were in care in a managed care system. They were in care at Preferred Mental Health Management before I came on board, and the other psychologists were not aware of false memory syndrome. And what we have over here on your right, $3,500 is in general the cost to us for providing services, inpatient and outpatient services to an individual. Here you can see the range from $63,000 to $20,000 to $18,000. The $18,000 only covers 1 year. The other 3 cover 3 years. As you can see, it's extremely expensive, even in a managed care system where you have a gatekeeper. And again, one of the important things is these people don't get any better. The person whose treatment costs $63,000 is on permanent disability. The person that costs $48,000 is also on permanent disability. Both of these individuals had jobs, were productive, self-sufficient individuals before they went into memory recovery therapy. So we're not just talking about cost. And again, part of what you have to be clear on is, where does that cost come from? Well, it either comes from your insurance premium or it comes from your taxes. One way or the other. That's how it gets paid. So it's extremely costly, and it doesn't work. It makes people worse. So what have we done? First of all, and I can't speak for other managed mental health care, I can only speak for Preferred Mental Health Management. We will not willingly provide coverage for people who are doing memory recovery therapy. We just won't do it. We screen our provider panel for those who do memory recovery therapy. We have a provider network of about 13,000 professionals, psychologists, psychiatrists, clinical social workers. We have a panel, or we have about 1,300 facilities. We go through those individually. We look, does the person specialize in treating sexual abuse survivors? Do they specialize in treating MPD? Which is always a flag for me because I don't believe in MPD to begin with. Do they treat dissociative disorders? And those are our flags for us. And what we do with them when we get that is we write them a letter, and we state very plainly that we believe that memory recovery therapy, abreactive therapy is dangerous, and we want to know whether they do it. And then depending upon their answer, we either include them in our panel or we don't. If we believe that they are doing memory recovery therapy and lying to us about it, we try and make it clear to them that we believe that it is something that is dangerous and that they are at risk for malpractice suits. And finally, we try and educate our patients. In our system of managed mental health care, except for emergency cases where people are admitted directly to the hospital as an emergency, they have to go through us. They have to be, as I said earlier, briefly interviewed by one of the psychologists. And if the issue is sexual abuse that they want to deal with, we educate them. We tell them, you don't have to go back and work through all of the pain and agony. There are other ways of dealing with those recollections. You don't have to go back and dig around and bring up all kinds of memories. That's not good for you. And if your therapist wants to do that with you, get back to us and we'll refer you to somebody else. Now, there's some good news here, and I think that this good news has a lot to do with the FMS Foundation and all of you here. We have seen over the last 2 years a decline in the number of facilities who do memory recovery therapy. They're still there, but we've seen a number of facilities who used to have trauma track programs heavily relying on memory recovery therapy who no longer do that. Who are now focused on the here and now, let's deal with your situation as it is, and get you going. And I think also in our provider network, we see far fewer people who say that they're specializing in MPD and dissociative disorders and such. So I think people are getting educated and the word is getting out. The bad news is there are those who are still very committed to doing memory recovery therapy, and they're going to be with us for some time. Now, I want to leave you with one last comment. I want to echo something that Dr. Mirsky said yesterday. And it's not a pleasant issue, and I hate to leave you on a downer, but it's something that I think has to be said. Most of you will recall the comment that Judith Herman made regarding those that don't believe in recovered memories are akin to those who don't believe in the Holocaust. I don't believe this was hyperbole. One of the most powerful driving forces behind memory recovery therapy is that it fits a feminist political agenda. This is an unfortunate aspect. It's an unfortunate aspect of the situation, but it's real and it has to be dealt with. And I think those of us who are in the profession, both academic or clinicians, have to be willing to deal with this issue. Thank you.